Hey, fellow Texas neurologists. This is Sara Austin. I'm the chair of the Advocacy Committee for the Texas Neurologic Society, and I'm just recording this quick video update for what advocacy is going to be working on in the next 7 months or so for the TNS. So the Texas Legislature starts again in January. We have a session every 2 years. This year happens to be the decade year, and so redistricting comes up. It comes up every 10 years. That tends to dominate the session in a lot of ways because it determines who gets reelected, and so your legislatures are very interested in that. The other thing that has to happen every 2 years is we have to pass a budget. This year, as you can guess, we have a $4.5 billion shortfall, or at least that's the estimate that just came through recently. It may change as time goes on. The legislators have to have a balanced budget every 2 years, and so they will have to make up that shortfall somehow. So we just had a recent election. The balance of power in the House and the Senate in Texas really did not change much. They're still both have a majority Republican, and of course the governor is a Republican. We have a new House Speaker. His name is Dade Phelan, and he's from Beaumont, which is my hometown. So those of us from the Golden Triangle might have something in common with Mr. Phelan. He's well respected. He's fairly young, and he's thought to be a moderate, and so people are happy to have him in that position. The TNS works closely with the TMA, as you guys know, and we're always interested in what the House of Medicine is interested in. Specifically this session, there's going to be some bills on telemedicine parity, payment parity for telemedicine. I know that's important to you guys as we're all doing more telemedicine visits as time goes on. Of course, neurology is very interested in Medicaid expansion. We have been for the past 6 or 10 years. It doesn't seem like it ever gets very far in Texas, but maybe this year will be a different year. We certainly lobby for it. We would like it to be expanded. Neurologists are interested in marijuana. A lot of the diseases that are allowed to be treated with medical marijuana in Texas are neurologic diseases. There are some rumors that those diseases, the list of diseases, might be expanded. This year, we always pay close attention to that. And we're also felt to be very helpful when it comes to marijuana legislation because we have some experts. Of course, all of this is happening on the backdrop of COVID. Nobody really knows what the legislative session is going to look like. I'm thinking that there is going to be first Tuesdays when doctors lobby their representatives. But I think it will look very different than what it has in the past when we all gather in one place and we all sit in a small room trying to talk to somebody. That won't happen for sure. We do have 2 really good lobbyists now. It's Tom Holloway as our main lobbyist and then Jim Dow. They've been working with us for the past 2 years and have really, it's been great working with them, so we're looking forward to that. They really keep track of the legislation that's coming through, and they let us know when we might be useful testifying or providing information. So we'll do our best to keep you updated as the session goes on. There's going to be an article in Brocas coming up in the next month, I believe. And thank you very much for your time.